Hello, good afternoon. Welcome to the Maine Women's Lobby Bill Bites. I am thrilled to have folks here joining us in the Zoom room and also on the Facebook live stream, and so excited to have Senator Anne Carney joining us today to talk about pregnancy and postpartum care. So welcome in, Senator Carney. You want to share a little bit about your district and who you're representing? Introduce yourself.
Great, thank you. So my name's Anne Carney. I represent Senate District 29, which is South Portland, Cape Elizabeth, and a little bit of Scarborough. I am in my second term in the legislature. I was in the House in the 129th and served on the Labor and Housing Committee. Now I'm in the Senate and I serve on the Judiciary Committee, which I co-chair with Representative Tom Harnett. And then I also serve on the Environment and Natural Resources Committee as a regular committee member. Some of the work that I'm doing this session is a continuation of work that couldn't be completed in the 129th when we had to adjourn early. And I can go into that in detail in a little bit.
Great, thank you so much for that. And just before we jump into the conversation here today, for folks either in the Zoom room or watching on the Facebook live stream, we really invite you to bring your questions and comments. So you can feel free to drop them into the chat or onto the Facebook live stream, and we have folks watching those, and we'll be sure to bring them into the conversation. So please don't hesitate to bring your questions to the table today. So, Senator Carney, we have a couple of bills that are addressing pregnancy care and postpartum care and recovery. If you want to give us a little overview of the bills that you're looking at.
Yeah, I'd love to. And I think I'll start by explaining kind of how I got into this. And it really comes from two different paths. First, I'm a mother. I have 3 adult kids. When my children, actually my oldest child was born when I was a student at the University of Maine School of Law. And then my youngest child was born during my first year as an associate at a law firm. And it was amazing to me the different concerns and how impactful everything that related to my kids was in my life. And the most simple, helpful thing helped me as a parent tremendously. When Lily was born, I was able to take advantage of reduced cost childcare through the University of Southern Maine childcare system. And just that simple subsidy improved our lives dramatically. When I decided to run for the House of Representatives, I heard from constituents that their top priority was affordable health care. And there were very strong advocates for a universal health care, like a Medicare for all type system. And I knew that as a state legislator and as a first-term state legislator, I couldn't fix that problem. But I started to look around for ways that I could make progress on that issue, and quickly realized in my research that Maine was not taking full advantage of the matching federal funds for the Children's Health Insurance Program, which provides tremendous support for working families. And again, it was similar to my situation with a little bit of help with childcare, just made my entire life easier with regard to taking care of my kids. And similarly, if we could give working families this little extra cushion where they could insure their kids through this fabulous child-specific health insurance product paid for primarily by federal funds, that it would make a big difference in people's lives. And it would actually really support our state too, because it would bring needed healthcare dollars into our state, and particularly into rural parts of Maine, which have the highest rates of uninsured kids. So that's how I started on the path. I introduced an act to provide Maine children access to affordable health care in 2019. And it made its way through the committee process and passed out with a favorable report. It passed the House in a roll call vote and the Senate, I believe, under the hammer, and then had been moved on to the appropriations table, and funds were never appropriated because suddenly in March of last year, the whole state economic picture changed.
Right.
In connection with the work that I was doing on children's health care, I became aware of really severe problems with health care for people who were giving birth. And one of the big concerns is that there's this group of people who have a very short window of prenatal and postpartum care, but the postpartum care coverage under Maine care ends 60 days after birth. And the concern with that is a lot of the more significant healthcare issues that arise as a result of childbirth, like postpartum depression, sometimes a need for continued substance use treatment, things like cardiomyopathy, and then just other physical injuries like pelvic floor injuries that can occur during pregnancy. All of that was necessary coverage related to giving birth, and yet people only had access to medical care for 60 days and were losing out on the healthcare that they so desperately needed. I also understood from the American College of Obstetrics and Gynecology that they are very, from a policy perspective, strongly in favor of extending postpartum coverage for a full 12 months. And that's part of a national movement, and there may actually be changes in the Medicaid statutes and regulations related to that. But that's something that's on the horizon federally, but it hasn't been adopted yet. So my effort to extend postpartum coverage under Maine care was connected to my children's health care, and that bill, which again didn't move beyond the appropriations table in 2019, would extend postpartum care for that full 12 months that's recommended by the American College of Obstetrics and Gynecology. So both of those bills are currently back in, and actually the timing for today's presentation is wonderful because they'll both have hearings before the Health and Human Services Committee next Wednesday, so a week from yesterday. And I think the hearing is at 1, it could be at 10, I'm not remembering right now, but if you go to the Maine legislative website and select the Health and Human Services Committee, you'll see the full committee schedule. You can sign up to testify in support of the bills. You'll also be able to find the bills. And if you don't want to appear on screen to testify in support of the bills, you can provide written testimony all through that same website. There's a third bill that I've been working on, which actually deals with the private health insurance situation. It came to light actually through a group of constituents who were advocating for more parity in healthcare coverage between postpartum coverage and, say, your healthcare coverage if you had a sprained ankle. So for those who receive, for example, like a pelvic floor injury in the course of a pregnancy, the coverage for things like physical therapy that would help treat what could otherwise be a lifelong impactful injury, you don't get the same coverage for physical therapy for a pelvic floor injury as you might for a sprained ankle. And that is an equality and parity issue that the legislation, which is I've offered this year, will also address. Because that's private insurance, that will go to the health coverage, Insurance and Financial Services Committee, and that bill has not yet been issued by the revisor's office or scheduled for a hearing yet. So I've been talking a lot. I need to take a sip of water, and also, I'm anxious to hear any questions folks have.
Great, thank you so much. And please do, if you're watching in the Zoom room or on the live stream, go ahead and send us your questions. But I, as sort of a policy geek, I love hearing about the different ways people try to chip away at these really monumental problems. And I particularly like this collection of bills because it deals with sort of multifaceted kinds of both health, physical health, mental health, children and infant health, establishing breastfeeding. I mean, it really, there's so much in here in just this collection of 3 bills. So I really appreciate the work that you've done to explore the different ways to address all the pieces.
Thank you. It's interesting because you mentioned breastfeeding, and I also did want to call people's attention to legislation that passed in 2019, which creates for pregnant workers the right to workplace accommodations related to pregnancy related conditions. And that has also changed Maine's laws and made them more family and parent and child friendly. And that's not a healthcare law, but it's related because, again, it's one of those small changes that can really have an outsized impact on somebody's lives and actually can really help make Maine a more welcoming state for parents and families.
Yeah, Maine was on the front end of that work, and I'd be remiss if I didn't mention that the Pregnant Workers Fairness Act was just introduced again last week into the National House, and so there has a good possibility of success there, which is great because we have a lot of that coverage in Maine, but people in every state who are working while pregnant deserve those protections.
Yeah.
In terms of this collection of bills that we've been talking about, and we have all of these in our tracker, so we will drop them into the link to the Maine Women's Lobby tracker into the chat for folks who are following along, so that you can keep track of schedules and LR numbers or LD numbers. But in terms of these bills, what do you see as the real opportunities or the real challenges in terms of getting them through logistically this session?
The challenge is going to be the availability of money to pay for the programs because, well, I'll just focus on the first 2 that connect to Maine Care, is that we know that the revenue situation in the state is really challenging. And so I don't think there will be any money on the appropriations table to pass anything that ends up on the table in 2021. 2022 could be a little different. The other relevant factor is that we saw once the pandemic hit, we saw that the federal Medicaid guidelines and funding and allocation of FMAP funds, those expanded a little bit to meet the gaps in care that were created by the pandemic, and in some instances by people who lost jobs and lost health insurance because they lost work. And so that little bit of flexibility federally has given me some hope that we could perhaps as a nation really expand the way we provide healthcare to children and move more toward a universal healthcare program that would, for example, provide CHIP coverage to all children in our country, regardless of income. I did want to mention that the CHIP bill that I've introduced, what it does is currently Maine's program only provides coverage to kids in families up to 200% of the federal poverty level, and the legislation would expand coverage to sweep in families, children in families with incomes up to 300% of the federal poverty level. And what that does is it provides coverage to, kids and families where the parents work as independent contractors or in the gig economy. It expands coverage to families who work for employers who don't offer employer sponsored coverage. Another problem in Maine with our CHIP program, regardless of the income level, is that there are a couple of barriers to care that cause kids to fall out of coverage, even if they are eligible. One of them is parent premiums. There's this requirement currently that parents pay a very minimal amount of premium. Paying that is still a barrier for parents, but significantly, according to the Health and Human Services Department, actually collecting those premiums is more burdensome than it is beneficial to the department. And so that is something that we can get rid of without creating any impact on our system other than improving coverage for kids. There's also a 3-month waiting period currently in state law when a child loses coverage under a private policy. And again, that doesn't really make sense because kids still need healthcare coverage, even if their parents have lost the ability to get coverage through an employer.
One of the questions I often ask and that I find really interesting is, are there any surprises or things that people would be, wouldn't necessarily know or expect about the bill or the process? And I think that you just named a really interesting one, which is that actually collecting the premium costs more money and more time or more labor or more infrastructure than just letting people have access to health insurance. So
yeah, it's one of, again, it's one of those simple things that can make a big difference in the lives of children and their access to healthcare.
One of the questions we have from the chat is, do we know how many children would be eligible for CHIP, the Children's Health Insurance Program, under the expansion proposed in your bill, going from 200 to 300% eligibility?
Yeah, so I don't have 2021 numbers or even 2020 numbers. When the bill went through the legislative process in 2019, the coverage changed a little bit. When I initially introduced it, I included coverage for 19 and 20-year-olds, kids who typically often are still in high school or are just, entering adulthood and still need the same kind of child-specific coverage that CHIP offers. And I also included coverage for kids regardless of immigration status. There's a small number of kids in Maine, I think it's like a dozen or so, who only are eligible to get emergency care under Medicaid because of their immigration status. And it seems to me that it's much more beneficial to cover those kids as normal pediatric patients. Those additional coverages that aren't subject to federal matching funds came out of the bill in the committee process in 2019. But at the end of the day, the fiscal note on the bill presumed that about 10,000 children would get coverage through the bill that passed out of committee in Maine. And that's kind of consistent with our numbers about related to uninsured kids in Maine. We actually have the highest rate in New England of uninsured kids. On the postpartum coverage bill, I think the estimate was 900 people would get coverage expanded from 60 days to a full year postpartum.
And one of the questions, are there federal matching funds on the bill that extends from 60 days to a year?
Yes and no. So part of that bill is to apply for some waiver programs, because there is some coverage, for example, I believe from some other types of programs, like programs for substance use disorder and a variety of other programs, and also policies that might be available under the exchange. What we could do is apply for a waiver that would allow us to use those funds to fund this state coverage that extends postpartum care from 60 to a full year. So that is something that the bill asks the department to apply for a waiver that would then allow those funds to come out of the FMAP funds rather than out of state revenue.
Is there a limit to how many waivers can be applied for, or a total dollar amount? Like, would that mean that there was sort of competition for, the ability to apply for that waiver or funds?
I have no idea. I
Oh.
just don't know anything about that. I do know that
Why?
the nonpartisan staff, the legislative analysts and representatives of the department were extremely helpful in helping me identify that possibility, and I trust their ability to give that the best opportunity Maine has to get those to be able to use those funds.
I think the nonpartisan staff are the unsung heroes of the legislative process. The folks there doing that back end work to make sure that everyone is informed about how to do this well. So I'm nodding to them.
Yeah, we have in our state government, we have amazing expertise, and I'm every day in every bill hearing incredibly grateful for the expertise that the legislative analysis bring to the process.
We have one other question in the queue, and as we come to the end of our time, I'll just say for folks watching, this is your opportunity, so we welcome your last questions if you have them. But one of the other questions was just a clarification on that CHIP expansion bill. You said that the original version included both the two going from 200 to 300% of the poverty, as well as the 19 and 20-year-olds and non-citizens. Those were stripped out of the original version. Are they in the current version that we're looking at this session?
Yeah, thank you for that question. Yes, I put them back in because my objective is to see that Maine children have access to the health care they need. And so Medicaid coverage for kids, which is identical to the CHIP coverage, has been in existence for over 50 years. There are all these longitudinal studies that look at rates of learning to read, rates of graduating from 8th grade, rates of graduating from high school and college, and you can even look at adult earnings through income tax payments. And if you sort out those adults who did have healthcare coverage through Medicaid when they were children, you see that they excel in all of those areas, graduating from high school, graduating from college, earning more as adults. And so as a policymaker, my objective is to ensure that all Maine children can kind of be the best learners and students and adults that they can be. And so that's why I added that in. I didn't see any reason to kind of sort out kids given that policy goal.
Right. I would agree and support that. And not only do we all survive and thrive when everyone has access to the healthcare that they need, but it also is better for the state economically to make sure that people are able to access preventative care when they need care and not have to wait until, situations are emergent. So, are there okay, another question we have from the chat: are COVID funds and stimulus packages diverting monies that would normally be available? So are there funds that would typically be sort of on the table for discussion during this legislative session that aren't because they're being directed toward COVID? Have thoughts about that?
I don't think that's the case. I mean, to some extent, the contrary was the case, that Maine got more federal health care money in the CARES Act and some of the other related federal legislation. So I don't really think that's the case. I think what's holding Maine back from covering things like children's health care is really the decrease in revenue, and the federal relief money doesn't provide funds to replace lost state and municipal revenue. That might change with legislation that gets passed this year, but in the past, there was no allocation that would make up for lost state revenue. And that's why, Maine actually, compared to other states, is in incredibly great shape. but we're still really struggling to be able to fund anything, that will be passed this year.
So where do you think people should go to either find more information out about this situation, or what would you like to ask folks who are interested in these issues to do?
Let's see. I would say go to the Maine Women's Lobby website and look for the information about the bills. Please provide testimony in support of the legislation if you are a supporter of it. Also wanted everybody to know that we have a new open enrollment period that started, I think, February 15th to enroll in health coverage on the exchange. I don't know if you have that information on your website as well. If you don't, I can provide it to you. People can also go to Consumers for Affordable Healthcare to learn more about how they can apply for coverage if they don't have it currently. But as far as children's health care, it would be really helpful to have your support and to have people tell their stories about how the legislation would improve the quality of their lives and make their kids happier, healthier children and adults. Because in the end, I think everybody in the legislature, we come at issues from different perspectives, but there is a lot of goodwill and focus on making Maine a good place for children and families to live. And the more we can all coalesce around legislation that allows that happen, the better off our state will be.
Wonderful. I'm so glad to have had you here today to talk about these things. I think they're really important as a cross-cutting equity issue. So I appreciate so much your time today and your focus on these issues. And we'll see you at the hearing next week.
Thank you. Thank you so much for inviting me. I really appreciate the opportunity to talk about these bills.